Hello, welcome to my video on pelvic scan. This is a part of our series called Be Aware, Be Prepared and Be Safe. This is an initiative to enable informed decision making by patients. Pelvic scan is a non-invasive diagnostic test which is an examination that produces images that are used to assess the organs and structures within the female pelvis. The female pelvic anatomy. The female pelvic anatomy includes the organs or structures that are solid and uniform, such as the uterus, ovaries, or that are fluid-filled, such as the bladder, which shows very clearly on scan. Bones may block the other organs from being seen, and air-filled organs such as intestines can make the image less clear. The organs and structures of the female pelvis are the endometrium, which is the lining of the uterus or the womb. The uterus is located in the woman's lower abdomen. It sheds its lining every month during menstruation unless a fertilized egg or ovum becomes implanted and pregnancy follows. Ovaries, there are 2 in number, and these are the reproductive organs located in the pelvis in which egg cells, that's ova, develop and are stored, and where the female sex hormones such as estrogen and progesterone are produced. Cervix, the lower narrow part of the uterus located between the bladder and the rectum. It forms a canal that opens into the vagina and it leads to the outside of the body. Vagina. Vagina is also called the birth canal, the passageway through which fluid passes through the body during menstrual periods. The vagina connects the cervix and the vulva, which is the external genitalia. Vulva, the external portion of the female genital organ. What is examined during a pelvic scan? The pelvic ultrasound examination usually includes the assessment of the uterus and ovaries, the endometrium lining, the thickness and echogenicity or presence of any fluid within the endometrium, mass or any space occupying lesion in the ovary, uterus or fallopian tubes or near the bladder, the length and thickness of the cervix, the changes in the shape of the uterus or in the bladder, the blood flow, any tumors such as fibroids, mass, cysts or any other type of tumors, the presence or position of an intrauterine contraceptive device, pelvic inflammatory disease, postmenopausal bleeding, and monitoring ovarian follicular size during follicular evaluation or infertility treatment. Aspiration of follicular fluid and eggs in cases of in vitro fertilization, and confirmation of a pregnancy and whether it is inside the uterus or in the tube. How is the scan done? Transabdominal scan. In a transabdominal scan, the doctor will ask the patient to drink 3 to 4 glasses of water 1 hour prior to the procedure. This is to fill the bladder, which will push the intestine away out of the pelvic organ so that the ultrasound picture is much clearer. Transvaginal ultrasound. A thin lubricated transducer probe will be gently inserted into the vagina to produce the image of the pelvic organs. The transvaginal ultrasound may give more information than a transabdominal ultrasound for women who are very overweight or obese, who are being checked or treated for infertility, and who have very difficult time holding a full bladder, and also have lot of gas in the intestine, which makes it very hard to see the organs from transabdominal. Also, the transvaginal ultrasound makes a clearer picture than a transabdominal ultrasound because the transducer probe gets much closer to the pelvic organ. It is often used in early pregnancy, but transvaginal ultrasound looks at a smaller area than a transabdominal ultrasound. If both transabdominal and transvaginal ultrasound will be done, the transabdominal ultrasound will usually be performed first. What impacts the test quality or results? The reasons patient may not be able to have the test or why the results may not be helpful will include the presence of stool, air or gas in the intestines or rectum, inability to remain still during the test, obesity, or having an open wound on the abdomen. Key points to be noted during a pelvic ultrasound examination. With a pelvic ultrasound, the doctor can tell the difference between a solid tumor, a fluid-filled cyst, which is either present in the uterus or tube in the ovaries. This is one of the main advantages of an ultrasound. Usually, a higher modality of examination such as CT or MRI is recommended, and in other cases, 6 to 8 weeks later, a repeat ultrasound or a pelvic examination is done. A pelvic ultrasound cannot determine whether the cyst or the tumor is either benign or cancerous in nature. Hence, further testing is warranted. Pelvic scan. To summarize, the pelvic ultrasound test is a non-invasive diagnostic exam that produces images that are used to assess organs and structures within the female pelvis. The scan is done either transabdominally or transvaginally. The transvaginal ultrasound often makes a clear picture than a transabdominal ultrasound because the transducer probe gets closer to the organs being viewed. For your benefit, all this information and more is available on our website www.chennaiwomensclinic.com.